we totally hear all of the things that as other public health professionals we assume are why community doesn't want to do something. Too often, instead of just asking the community what they need, what they want, what would be beneficial.
Somebody from the Native community said something that really I keep remembering and reminding is that we don't educate people, we share knowledge.
I learned that conversations are very powerful and that there is a lot of knowledge in the community. Some people were hesitant, but many answers came from our participants. They didn't came from us.
Something that I learned from the community that I've brought back to other communities and other people is that it's about who influences these choices. I remembered one of the first conversations I got to be a part of, I had just thrown the question out because it was around that time where you were seeing all of these like high officials being vaccinated on TV, like they'd stop everything and be like, now we're gonna focus on insert celebrity's name being vaccinated. And I asked everyone in my room, I'm like, so who does that influence you, or who influences you to get this? And just hearing that, it's not even knowing that like the governor's been vaccinated that's going to get people vaccinated. It's knowing that someone in their personal circle has. And also that helps so much with hesitancy. So many people that they were like, yeah, I was so hesitant to get it. And then I found out my friend got it, or my friend's mom got it, and they told me more about it. So it's just using these personal networks and being able to share that story. And so many people in the group that they were talking about how they plan on sharing it on social media when they get it, because they think that their personal influence is more effective in this reality than like seeing some of these celebrities and higher officials get it. So that was something that was really exciting to learn.
And I think I learned the most from the youth who attended, because in a lot of the conversations that I've been a part of at the state level, we haven't been getting feedback from kids because they're not eligible to get the vaccine yet. And hearing from youth about how much they knew about the vaccine and how they had been kind of the ones leading their older family members to understand why this was important, I think gave me so much hope.
We all agreed we wanted to have the vaccine. There was some fear over, side effects. I think Erica had problems with the flu vaccine before, and she just wanted to make sure she could take care of her children.
A lot of our conversations centered around healthcare providers and like patients, as far as like doctors or providers not necessarily believing people's symptoms or having like the correct treatment for people as well.
Figuring out what to do with the process. So in terms of barriers to the vaccine, how do you, for instance, with technology, figure out if you're using multiple apps and services, the right way to register? Do you trust that? We're all trying to do the right thing, but it feels a little disjointed and that can be overwhelming.
The variants that came out and how effective the vaccines will be against those variants.
It's amazing how people take on. You ask them a question and they tell you stories. And a story that stayed with me and then I repeated to others was an elderly woman who was saying, I'm the matriarch in my family. And I feel it is my responsibility to be here for them.
I think I attended like 5 or 6 across the board and able to engage and really get the full concept of people. What it did, it changed my mind. It shifted me towards wanting to get the vaccination. And when I say that, it's not a thinking thing that stopped me. It was an emotional thing.
I learned how it is an act of courage to get the shot. Because for a lot of people who have a lot of doubts about the vaccine.
People get information from different sources and some of the information is the good one. So they get from their community, education places, and I've seen a kind of an evolution in the knowledge of people from the first conferences to the last ones. People know much more about what to expect from the vaccine.
In one of the unconference meetings, someone was asking questions about specific resources for trans community, and I hadn't ever thought about there might be different concerns than things that I'm concerned about. I was given so many incredible resources from people who were participants that I then was able to take back and share with MDH that we've been able to share out to partners and make more accessible. I don't ever want to be called an expert on anything ever again, because I think like our communities are the biggest experts for themselves.
We all had concerns. They were just at different levels, and of wanting to know, and also the concern of not knowing and needing to know those questions, ask those questions, whether it may sound silly or naive to them. Those questions were important and very validated for the individual because they were the ones that had to make the decision.
A lot of people came to our conferences not willing to get the vaccine, but the being here, it kind of changed their mind.
I'm hopeful for these type of conversations. I really have enjoyed this.
The quality of the conversations that we had is what was very impressive to me, that at the end of those sessions, people shifted their minds. They were in a different place.
Unity makes us stronger. And like this was like a support group for people that had doubt, for people to come and tell us their questions, their needs, their concerns. Having accurate information from our professionals really helped them a lot.